Hello, everybody. A very, very warm welcome to Dorset Healthcare's annual members meeting. I'm Andy Willis. I'm the privilege of being the Trust Chair. Obviously, this year, due to national advice, we've had to change how we hold our annual members meeting. So we're going to do it virtually for the very first time. It's going to be different, but I'm really glad that you've been able to join us for our inaugural virtual AMM. We have done our very best to give access to as many people as possible, but it will unfortunately be subject to your broadband and Wi-Fi connection. So what we've decided to do, we're going to record the event and we'll put that upon our website so you can have access to it should you for some reason technically not be able to remain in the meeting for the full length. Later on in our session, we're going to be talking about the transformation and change, and Eugene, our Chief Exec, will be talking about that later on in the meeting. But before we go into the nuts of the meeting, we're going to really focus upon the most important thing, which is our patients and how our staff have supported our patients over the last 12 months, particularly during this period of great change. So if you'll please settle down and listen to our patient story, and I'll come back to you after the patient story has been heard. Thank you very much for joining us.
I've known Sophie for 5+ years, I think. She originally had an appointment with one of our old consultants, and as part of that, I became involved doing some direct work with her.
Sophie was referred to, she was suffering with high anxiety after the loss of my father, and she was suffering quite badly at school, so school referred her.
Gary is he's very interesting. He's not really like your stereotypical therapist. He's really nice of a person, and it's very easy to know what he looks like. He's definitely one of the best.
We've used the Attend Anywhere NHS video platform. When that became available to us, I suggested it to Sophie, and she was really quite keen. So she's very tech savvy, so uses her mobile to communicate, and it's worked brilliantly, really. And every single week we meet up on Attend Anywhere, have a chat, go through a treatment plan, and I think she's getting a lot out of it.
It's actually been probably much better than just going in normally, because I don't have to smell of the building, because I'm a bit more I have a bit more my sensory stuff. My senses are a bit more sensitive to the others, and the other times and normally it's always loud, and then I have to think of something for my brother to do. But now that we're at home, it's all much easier.
Even I can manage it, and I'm not very technical at all.
Oh, we've most definitely been fitting more people in a day, because you just need a really short break between each one. So maybe where I might have seen 4, I might see 6 or 7 patients in a day. Now, it does increase the workload, but you do get things done quicker without the travel.
He get me to do some baking and stuff through that, and I made some scones, and I think he enjoyed it a lot. he enjoyed the fact that I made them all by myself.
It's part of a whole package of treatment really for Sophie. We use an adapted CBT type approach with her, where you look at her thoughts and you're trying to change the negative thoughts into something positive. And one of the best things that helps Sophie with all of her issues is distraction and finding something positive to do. And I think with lockdown, people were sat on their sofas day in, day out, hours on end. And I thought it was important to get her up, get her moving, get her focused on something positive. And she took that on board 100% and really bought into it all.
Cooking and baking was definitely my favourite. And steps as well. Walking with my friends and stuff like that. They've all been really good.
For one session, I would say, okay, what's your task going to be? And Mum would say, well, let's make some cakes or something. So Sophie would get into that. She'd make the cake, she'd take some photos. So during my next session, she could actually show me that she's done it. And talking to Mum, and she said that Sophie really does like me giving her things to do, like setting her little challenges. I think I spoke to her at the end of last week and set her another challenge to write a cool list and a rubbish list, like 5 cool things that have happened to her and a couple of things that haven't been so good. She got on really well with doing that, and it works well for her.
Right at the start, I absolutely hated it. I didn't like it. But now that I've been there, I actually now love it. I think it's one of those I had to get used to moments, but now it's much easier. I didn't enjoy it at first because he made me do a lot of work, and I didn't like the work since I spent like 40 minutes. But now that I'm a bit older, I don't have to do the work anymore, and I can only just talk to him all about my worries and all the things that I don't have to. Because I'm starting to grow up a little bit more. Like, I had to go into a taxi all by myself. I had to do a lot more stuff by myself. I had to have more responsibilities. It took me a very long time to process that, but I did it in the end.
So I plan to continue to see Sophie until she's 18 and moves to adult services. But most of all, Sophie is just an amazing young woman. And I think her future is really bright. She's got the potential to have a job and be really successful, earn her own money. I think our team has embraced the technology 100%, and we're using it to its full capacity, really. We are moving towards seeing people where it kind of adds value into what we do with them. We do have clinic space available, and we do use that following all the government guidelines, of course. We'd like to think about the future having a combination, but I think I'll go back to what I said previously, really. You can't beat seeing someone in person and being in the same room as them.
If I didn't have Dorset Healthcare, I probably would have gone much worse, and my anxiety levels would have just gone over the roof. But now they're not as bad. There's still, of course, there's still anxiety, but it's not as bad as before.
One of Sophie's anxieties is travelling too far. And so obviously to travel all the way over in rush hour, it's not so much the distance to Southbourne, but actually the length of time it took us to get from to there and back again. Actually, the Attend Anywhere has actually worked out really well for us. To be honest, from a parent's point of view, it's a lifesaver. Because like I say, some of the things she'll take them as guaranteed from Gary, where she won't, if she doesn't take it from a parent, sort of thing. We're white noise after a certain length of time. But she listens to him and she acts on what he says. So he'll give a task to do and she'll go away and do them just to prove to him that he's right. Like she was poorly a couple of weeks ago. She was really stressed out. Poorly is too strong a word for it, but anyway, she stopped eating basically. But then she spoke to Gary, and Gary literally told her the benefits of eating and why she must eat. And he made her promise to go and eat, and literally put the phone down and went and had something to eat. But previously, so she hadn't eaten for a few days. So it was something as simple like that, something he said, she took as gospel. I can't thank Gary enough. And I also I can't not thank Helena, because she's done a lot of work with Sophie, and she must be the most incredibly calmest person I've ever met in my life. And she's she's amazing, and she's done a lot of work with Sophie, and so's Gary. I mean, both of them have been brilliant. There's not really much more I can say about them. They're both fantastic. But again, that's number one thing of him building up her confidence, the ability that she can do anything. He stamps down all of her negativity and then builds up on her confidence, which is brilliant. You know, it's and again, like I say, it's white noise from me. It's all right for me telling her she can do anything she likes, or that's fine, and you know, she will be fine. You know, to have that belief in herself has made her grow into a very, you know, interesting teenager. You know.
A huge thanks to Sophie and her family and Gary for sharing their experiences of delivering care through Attend Anywhere. I think for me, it just shows that we can make a real difference to people's lives, even if we're not delivering service in our traditional way. I'm very conscious that the pandemic has had a real significant impact on many of our services, and some of those services in the initial period had to be stood down. I'd just like to say how difficult that must have been for many of our patients, and I know it was frustrating to some of our staff as well. So to patients, thank you for your support, resilience and fortitude, and I know our teams are working incredibly hard to try and get all our services back up to the level they were before the pandemic. All I would say is it's incredibly difficult to do that in some cases because we're having to work in constraints of infection prevention and control, which have an impact upon the total number of services we can now deliver from our different locations. To our staff, and I've said this before and I will continually say it, your amazing resilience and commitment has shone through over the last 6 months. Many of you have been at the rock face and have had to be caring for many COVID patients. Others have been deployed to delivering services that you never joined up or envisaged to be delivering. And then many of our staff have then been working from home, having to manage the conflict between doing their jobs and looking after children while they've not been at school. To all of you, thank you. The board is incredibly proud of what you've done. We're in a strong place going into this winter, and so I'm hopeful that we will continue to have much lower infection rates in Dorset, and the only way we'll be able to do that is we all work together to comply with infection prevention and control at every situation. Looking forward just a minute, the new strategy that the board has approved in its September board meeting will be rolled out in the next few months. It's going to focus upon 4 key things. Outstanding quality services, because we have some outstanding services already, but there are others which we can still improve, and we will drive to do that with our teams. Supporting people to have healthier lives, and I'm going to come back to that in a second. A lot of prevention and something we can do to help ourselves and our role to support people in doing that. Maximize the value that we get from what we do, and the sustainability, be it financial and environmental, will be a key platform of our next phase. And then we want Dorset Healthcare to be the best place to work, because as I've said many times, organisations don't deliver outstanding care, our teams do. And it's even more important now that we make Dorset Healthcare the very best place to work. I'm just going to go back to one of those 4, which is healthy lives. I'm very conscious that as individuals, both patients and staff, we can and must maintain our well-being, okay, and healthy lives. I was very conscious. I tend to do quite a lot of exercise. During lockdown, I didn't do as much. And when I came to put on this suit not so long ago, there were moments when I was thinking, well, if I'm going to do the annual members meeting in a few weeks' time, I better do something about this. These things sneak up on us. So I would just encourage everybody to do the very best they can to keep themselves well, particularly our patients and our staff, obviously. The other angle, as well as physical, is our mental health, and being away from the infrastructure that we're used to working with has different impacts upon all of us. And I would really encourage people not to wait too long to seek support, because if you seek support early, then the size of the problem will be much less. So please, access that support if you need it. So now we go on to the next part of this annual members meeting. I'm very conscious that there is a Q&A facility on your systems. I would encourage you to put any questions in the question box as we go through the annual members meeting, and our team will then pull those questions together, and at the end of the annual members meeting we'll have a Q&A session. Okay, but I'll say more about that as we go, but certainly please fill in the questions as we move through this meeting. It's now my great pleasure to hand over to Eugene, our Chief Executive, who will talk about not only things that have happened over the last year, but equally important about the future and how Dorset Healthcare aims to help our patients and our population of Dorset. Thank you. Eugene, over to you.
Thank you very much, Chair. It's a great privilege and honour to be reflecting on the previous year as Chief Exec and to think about what we want to do going forward as an organisation. I think it would be really impossible for me to start talking about the past year without reflecting on how different life seems to be right now for all of us since the pandemic hit. As a trust, as Andy was saying, we have responded through significant and rapid change, and we've adopted new ways of working and have had to reimagine what work is, where you deliver work from, and where we deliver care from. We continue to work with partners across the Dorset integrated care system to be able to respond to the pandemic, and I do wish we were able to talk about the pandemic in the past tense, but it's still here with us, and also how we recover services as a consequence of both what we've learned during the pandemic and what we need to do to ensure that we respond to the needs of the people of Dorset. Our response, as Andy has highlighted, has included a number of things that a lot of colleagues had not appreciated they would be doing when the year started. We've had to reduce or close services, redeploy staff to work in new areas where they may not have worked for a considerable time. We've also set up new services during the pandemic as part of our response. One of these services was the discharge to assess process, where we try and make discharge from hospital as smooth and as quick as possible to ensure that people get home and can be cared for in their own homes or where they're going to be receiving care. We set up the mental health emergency assessment service, as well as the Dorset Stroke and Neuro Rehab service. Digital innovation has enabled us to continue to provide a lot of our services, and this has been through what has been shared in the patient story, which is Attend Anywhere, staff working remotely using Microsoft Teams, and a range of other interventions that we've had to use to be able to sustain our services. And not everyone has found this user-friendly. Not everyone has found this the best way to be able to access services, and try as we might to reduce the impact of the changes or closure to services. I do appreciate that there's some services where patients and their families have felt that the response is not what they were used to, and this is something that we're going to be picking up and working on as we move through the year. I'm incredibly proud, humbled, and absolutely astonished at the additional resolve, resilience, and commitment shown by my colleagues throughout the pandemic, which continues. And I'd like to thank you all for what you've done and what you continue to do in providing outstanding quality of care to the people we serve. Despite all of the challenges of managing, responding to, and recovering our services because of the COVID-19 pandemic, there have been a great number of successes, and we've made great progress across a number of our services. And some of the highlights that I want to share are from the Integrated Community Services Directorate, Mental Health, and also our Children and Young People Directorate. Within the integrated community services, we saw the transfer of the NHS 111 service from the Southwest Ambulance Service to Dorset Healthcare in May of 2020. And I was delighted to welcome 260 colleagues to be part of the Dorset Healthcare family. And we all know that the 111 service is a critical gateway to a lot of the health services in Dorset, and we will continue to strengthen this service as we respond to the pandemic and move into winter. The Yetman Hospital, where the Willows Ward was awarded the first ever Gold Standards Framework Hospital Ward of the Year for end-of-life care, and that was in October of last year. The Victoria Hospital in Wimborne got their JAG accreditation for GI endoscopy in January of this year. Swanage Hospital and Victoria Hospital in Wimborne, their radiology departments got accreditation for quality standard for imaging in January again of this year. And we opened the new Colmers Ward, a 24-bedded ward in Bridport in February. And because we know some of the successes that we've had previously, we have launched a new service called Dorset Open Door, which works in conjunction with the third sector and health and social care providers to be able to support people through bereavement. So really great things that we've been able to do across our integrated community services. When I look at mental health services, it's a year since we launched Access Mental Health, which is the service that brings together crisis services so people can better access services when they need them through the connection, the retreat and community front rooms. These services have been a huge success, accepting that we might have had to stand them down or change the way they work through the pandemic. But certainly leading up to that time, they have been really popular with people who use our services because people are now able to describe what they need when they are able to articulate their own crisis, not what the service will tell them they need to be able to meet for them to be able to access services. Our CAMS Gateway service, which is a new way of assessing and offering interventions for children and young people, went live in September of this year in the BCP area and will be rolled out to the rest of the county into 2021. We will be working furthermore on our CAMS and forensic new care models, which is how we're working in concert with other providers to be able to ensure that there are better services for local people closer to home when they need them. Steps to Wellbeing turned 10 last year, which is quite a milestone birthday, and we established a new service for Steps to Wellbeing in Shaftesbury. When I look to children and young people services, our 0 to 19 service went live. This is a new service last year, so it's about a year old as well. And we also had a school age immunisation programme that was launched this summer. Over the last 4 years, we've been working in partnership with other providers in Dorset to bring together the network of sexual health and reproductive services for Dorset. And the beginning of October was quite a momentous time for us to be able to bring together under one umbrella all the services that make up sexual health services in Dorset under Dorset Healthcare. And we welcomed on the 1st of October 62 colleagues from Dorset County Hospital and the Royal Bournemouth, and we launched the new sexual health service for Dorset. And this is testament to the hard work of colleagues over a long period of time in order to bring our services together and create the pathways that make the difference for the people of Dorset. Now, when I look to the future, Andy has already talked about what we have set ourselves as a challenge in our strategy. And the new strategy is looking 5 years forward to 2025, where we hope that we are absolutely better every day through excellence, compassion and expertise, and are delivering the services in the way that they are required by the people of Dorset. And I will touch briefly on the strategic ambitions, knowing that Andy's already given you a flavour of these. I think for outstanding quality services, this is something that we have put front and centre for our organisation, because ultimately the quality and safety of service is something that we are going to continue a relentless focus on. Healthy lives is the second strategic ambition, and I think there is a real focus on reducing inequality. We know too well that in the last 6 months, COVID has absolutely highlighted inequalities within our different communities and society in general. And we want, as part of the integrated care system, to be contributing to how we reduce inequalities by supporting people to have healthier lives. We want to maximize value and sustainability, and also make sure that Dorset Healthcare is the best place to work. Underpinning these strategic ambitions are three triple aims, they're called. So 3 things that we want to satisfy ourselves as an organization. With every change that we make, with any improvement that we make, we want to make sure that we are absolutely improving the quality of care that people receive. We're improving the overall health of the population of Dorset, and we're looking to reduce the cost of care either through innovation or transformation. And supporting this work, we will have strategies that we've agreed around clinical and quality, digital estates, our green strategy, absolutely testing and challenging ourselves on the impact of what we do on the environment as an organization, and to support how we become the best place to work, our workforce and OD strategy. We're not an organization that can do all these things by ourselves. So we also have a public participation and engagement strategy that enables us to make the connections and alliances that deliver for the people of Dorset. Quality improvement and transformation is going to be how we deliver and deploy our new strategy. And I think sometimes these words make people wonder whether we are throwing up everything into the air and going to start again. Absolutely not. We're not ripping up the rule book, but it is a next step in the development of Dorset Healthcare as an outstanding organisation. So we will continue our relentless focus on improving patient safety, clinical effectiveness and patient experience. And one of the things that I want us to be able to look at in 5 years' time, just by way of example, is to ensure that we're an organisation that has absolutely 0 inpatient suicide. I think it's one of the things that we now need to give ourselves as a challenge to learn from the past and make our services the very safest services possible. Part of this is going to be pushing the boundaries regarding the inclusion of people who use our services so that we can co-produce the new models of care and service delivery that make sense for them and enable them to interact and engage with Dorset Healthcare in a meaningful way to deliver the best possible care for them. I also think we should challenge our thinking regarding the art of the possible. So we've talked about digital and the things that we've been able to do during the pandemic. I think we can go even further in terms of using artificial intelligence to make patient safety everybody's business in Dorset Healthcare. How do we maximize remote working and use of technology to be able to be more productive and also allow people to have a better balance between work and life? How do we maximize the use of digital consultations and interventions where they are appropriate and use those alongside the more traditional ways of delivering our services? And how do we as an organization become more agile, not because it's fashionable, but because it's the best way for us to be able to respond to the needs of our local population? I think we will continue to make the connections locally through the integrated care system, regionally and nationally for the benefit of the people of Dorset. We'll continue to improve our capabilities as an organisation to do things better. But all of the things that I've mentioned pale into insignificance if we do not create and continue to develop psychological safety within our organisation. Psychological safety, for me, is how everyone in Dorset Healthcare feels listened to, feels able to contribute, feels that their voice matters. And this is particularly important when we want to focus in on quality improvement and transformation, because people will feel safe to engage with, they will feel safe to make the changes in the interest of the patients in front of them, and they will feel safe to speak up when things aren't working. And the way in which we do this, the way in which we develop psychological safety is through developing our leaders, both clinical and non-clinical, and creating an inclusive and absolutely just culture within Dorset Healthcare. Now, there's specific things that I think would be important to highlight in terms of next step transformation for the organisation. During the course of 2020, 21 and into 22, we absolutely have to develop our 111 service further. So this is a service that we took on in June. We understand that there were things in progress to be able to strengthen the service. From December and going into next year, a lot of the people who would ordinarily go into the emergency department would be expected to ring 111 in the first instance. So we need to develop the capabilities to be able to give confidence to the people of Dorset that when they ring 111, they will get the right service. So we're going to be looking at strengthening this service as we move forward. I mentioned earlier about the discharge program that we started in response to the pandemic. And we call this Home First, because we acknowledge that we should always consider people's homes first before they either go into hospital or go into care. So how do we make people leaving hospital seamless? How do we connect what we do within the community with local authorities to ensure that people are able to get out of hospital at the earliest possible opportunity to continue their treatment at home? We want to continue working with our primary care networks as they develop and create the services that are required for the people of Dorset. People would have heard the announcement last year and in recent weeks about the new hospital build programme. Dorset Healthcare is fortunate enough to be mentioned, and it's one of two community and mental health providers named nationally to be receiving some of this funding. And through this, we hope to be developing a new child and adolescent mental health unit in Bournemouth, and we will be working with partners to be able to do this. As part of the NHS long-term plan, we have a once-in-a-generation opportunity to be able to develop mental health services that probably haven't had transformation for quite some time. And we want to create a modern, responsive and effective community mental health offer for the people of Dorset to be able to provide them with the services that they need when they need them and to support their health and well-being. We'll also be working with partners to introduce our new care model for eating disorders across Dorset, Hampshire and the Isle of Wight, which will go live in April of next year. And the bedrock of all of this is engaging our colleagues and ensuring that we've got the right capabilities, both clinical, digital and estates, to be able to deliver these new services over the next few years. When I reflect now on what has been done, I think it's important that I acknowledge that we have gone through a period of great change over the last few months. And I know colleagues have said that they have felt tired and they have felt exhausted, but I remain optimistic. I remain optimistic because we are an organisation that is built on the values of working together for the benefit of patients. We do not know what 2021 will bring. The pandemic is not something that we're going to be talking about in the past tense, but I think that the strength, resilience and commitment that we've shown puts us in good stead. There will be opportunities for us to be able to work together for the benefit of our communities and continue to provide services where we can say that we are better every day. I remain very proud to be Chief Executive of Dorset Healthcare and would like to thank the Board of Directors and the Council of Governors for your support and challenge over the last year. I would also like to thank, most importantly, the 6,000 strong colleagues across Dorset Healthcare. You are the beating heart of Dorset Healthcare. Thank you for everything that you've done for us to be able to achieve what we have over the last year and to date. Thank you for what you're doing today. Thank you for what you will do tomorrow and through the next year. I leave you with a thought, colleagues, and this is something that was shared during some of the tea and talk sessions that we've had online, where it almost seems that what we have been doing over the last few months has almost created two bits of the organisation. What we now have is an opportunity for us, through our values and our shared commitment, to deliver the best possible care for the people of Dorset, to come together and to continue to provide the best possible care. And through that, we can truly be better every day through excellence, compassion and expertise through all we do. Thank you, Chair.
Thank you, Eugene. I think what you summarised there was an extraordinary progress, even in a difficult situation. And our staff are, like you say, amazing. What I'd like to do next, please, is move on to introduce our lead governor, Jan Owens. Jan and the governors have needed to adapt like we have over, and the rest of our teams have over the last few months. And I'm very grateful to the council, as is the board, for your support and challenge. You've always, as a council, and Jan in particular, championed our patients and local people. And we value that challenge and sometimes a reminder of why we're here and what are the real interests of some of our less obvious community members. So Jan, over to you for your summary of the last year. Thank you.
Hello everybody, I'm Jan Owens and this is my annual report to members on the activities of the Council of Governors in 2020. This is my third and final report as I retire after this meeting, so I thought I would reflect briefly on the last 3 years and then I'll tell you how tough this year has been. When I was elected as lead governor 3 years ago, the council was clear about its role and responsibilities in holding the board of directors to account, and we'd begun to think about our other main task in engaging with our membership and our public. So when I became lead governor, we started a members' quarterly newsletter with the aim of getting information published about the services provided by the Trust and developments that were being made. And I hope that's now meeting your requirements for useful information and updates. At the same time, we wanted to meet face to face with members of the public and yourselves to hear your views and to report them back to the executive. We started with a really successful meeting in Blandford in 2018 on pain management, and this encouraged us as governors to put on more public meetings. So early in 2019, we ran 3 public meetings in Weymouth, Sturminster Newton and Poole, asking people how they rated Dorset Healthcare Services and what more they would like from us. The overwhelming view was that people wanted more information about what services are available and how to access them. They were also concerned about the transport difficulties in reaching appointments in rural areas and asking the Trust to consider the transport required when moving any services to new sites or developing new services. These views were fed into the new Trust strategy, which is just about to be republished, taking account of the changes made as a result of the COVID pandemic. And I'd recommend that you read it, as it really shows clearly the direction of travel for the community and mental health services in our area for the next 5 years. So, building on that success of the public engagement meetings that we'd held, the council planned to hold regular meetings throughout this year in different locations across our patch. The idea was to focus on the most significant health needs for that community and to have local clinicians talk about the services that they run. I am so disappointed that that COVID shutdown stopped this from happening, and I really hope that the council will ensure that this engagement will be resumed as soon as possible. So, moving on to the story of this year, it's certainly been tough for all of us, and certainly disappointing for me and the governors. It seems amazing to think at this time last year we hadn't heard of COVID, and now it feels as though it controls our whole lives. Our work as governors stopped completely for a couple of months to allow the senior managers to rework the Trust services and to reposition staff to meet the crisis. Everything went online, and many of us were working from home in relative isolation. Our corporate and our individual learning curve in digital technology had begun, and I'm pleased to report that governors are doing well with it, and it's had some positive benefits, like not having to drive all over the county for meetings, but most of us have missed the contact with others, which binds us together and means that working cooperatively is less easy. As the lockdown eased, the governors became increasingly concerned that we need to exercise our responsibility in holding the board to account for the performance of the trust. The board of directors began meeting again virtually, and governors were able to watch the proceedings and eventually were able to question and comment as usual at the ending of the meetings. The council itself began virtual meetings at the end of May. The months June and July seemed particularly hard, learning the lessons from the COVID crisis and trying to anticipate its effects longer term. What services needed to be provided, how they could be delivered, whilst ensuring that all our essential services were continuing to meet the needs of the patients. We knew that patients found the increased use of online technology to access health services was better for some and worse for others. Some felt the benefits of the ease of access, but others found it off-putting and difficult. And governors have consistently raised the need for the trust to provide patients with the choice of phone and digital access to services, but also ensure that there is access to clinicians face-to-face when necessary. In truth, the increasing digitalisation was always the way the NHS was moving as a whole, but the pandemic has speeded up that transformation, which is the theme of the meeting today. The last board meeting that governors attended this September was excellent. The trust strategy, with all its supporting strategies for the workforce, for finances, for sustainability and digital, are all set out as a clear direction for the trust, which will be underpinned by the outcomes required and their timescales. The board members, both executives and non-executives, were working well together, and it felt like the board was demonstrating the kind of leadership required for this essential part of the health service, namely the support for the people in our local communities who require care in their own homes or as close to it as possible. On behalf of the Council, I'd like to thank the board, who have all made great contributions towards this trust being rated outstanding by the Care Quality Commission. The Council of Governors have been actively working with board members to identify the skills needed to strengthen the board and have been involved in running an extensive recruitment campaign. The Council considers that in making appointments to the board, it will be able to continue to lead Dorset Healthcare in a robust and sensitive way. So, in coming to the end of my third and final year as lead governor, I feel satisfied that the Council has carried out its duty in holding the board to account to the best of its ability. Now, in terms of the Council's responsibility to the Trust membership, I have to report that the number of public members has increased by 8% and now stands at 5,296, and that's in addition to the staff. So our total membership stands at 12,906 for this year. It's good to see that increase in membership and illustrates that the Council's membership strategy is working. Some of it has to be attributed to the massive amount of work put in by our membership manager, Jacqueline Stratford. She has been absolute linchpin between members and governors. She's supported all the governors with ideas and information and advice, and she's always so calm and positive. I couldn't have done my job as lead governor without her. And she invites all members to keep in contact with her and let her know of any issues they have. My thanks also to our 6 staff governors for the work that they've done with our staff over this year. They've explained their role, they've promoted it, and taken up staff concerns with the chair of the trust and the council. They're the eyes and the ears of the council, and they've kept us aware of what's happening on the front line, both in terms of staff care and services. They've been exemplary. We're now losing one of our longest serving governors, Pete Kelsall, who has 9 years experience as staff governors and the scars to prove it, and he would be really hard to replace. I'm afraid I can't announce the 2 new staff governors or even the public governors, as the election results haven't reached me yet, but the chairman will be announcing the results, which will be in the members' newsletter and on the Trust website for everyone to see. Just to let you know, the Council is undertaking its own transformation. As the role of lead governor has grown so much over the past 3 years, it makes sense for the work to be carried out more collaboratively. There will be one governor with the title lead governor, who has responsibility of contacting the regulator if the council thinks the trust is in breach of its licence. But the rest of the duties of the lead governor will be taken up by active and interested governors. And there will be more information on the trust website in the near future about that too. So finally, I'm so sorry that it's not been possible this year to hold a real annual members meeting. I've such good memories of the last one, when our medical director demonstrated how the new 111 system was going to be working, and over 200 members attended and were able to question him directly. That 111 system has become virtually the single point of access to all National Health Services, making this trust crucially important in the whole integrated system of health and social care services in Dorset. Now, I've filmed this because everything's so unpredictable at the moment, and I wanted to make sure that I could thank the Chair, the Council, the Trust Secretary, the Board of Directors, and all of you for making my time as lead governor for Dorset Healthcare such a pleasure, and I will treasure the experience forever. Thank you.
Thank you for that, Jan. You have had a very, very challenging 3 years. You've changed the role into something much more significant than it was when you took over, and that has required immense dedication and commitment. So my heartfelt thanks to you, and I hope you now have a deserved more time to yourself to do the things you would like to spend your future years doing. So thank you very much on behalf of the board and the council and myself. It's at this point then that we hand over to Matthew, our finance director. Matthew will take us through a quick look at the finance over the previous year. Finance itself is not important to a health organisation, but what it does do is give an opportunity with stable finances to do amazing things for our population. It's the precondition to helping people and delivering outstanding care. So Matthew, thank you to you and your team for all the work you do. Over to you.
Andy, thank you for that. And I'm pleased to report that we're smack on time. So to add to that, I think as a sort of retrospective over the course of the year ended 31st March 2020, there has been considerable continuity with past results. We were able to deliver a very sound set of results, and everybody will probably acknowledge that we, as everyone's become used to, had a clean bill of health from our auditors, KPMG. So very much in summary, our reported results showed a small surplus. This was essentially due to us delivering against the plan that we'd agreed with NHSIE. And as a result of that, we're able to be awarded the PSF funds, which is the Provider Sustainability Fund incentive that we have for hitting our plan of 2.2 million. So without that, broadly speaking, we're a break-even organisation. But because we hit our plan, we were able to gain the rewards of that. Behind that was a keen attention on controlling our costs. So we were pleased to report last year that we were able to deliver the cost savings required in order to meet that plan. There are some challenges as to whether we can sustain that. So not all of those cost savings were necessarily recurrent ones, but nonetheless, in the year ended March 2020, we hit 100% of expectations. We found it more challenging last year to achieve the level of recruitment and therefore reduction in our dependency on agency costs than we'd hoped. Although I'm pleased to report that since the year end, we're now running at a level of agency costs much closer to the level that we'd anticipated in 1920. And I think that in many respects both reflects recruitment, but also the extraordinary goodwill that we have generated amongst existing and past staff in terms of working on our bank and amongst our temporary workforce, which is really a key component of our ability to sustain the services that we do, particularly in the current climate. From a capital expenditure perspective, we almost hit our plan, and I'll comment a little bit of that as we go through to just have a look at some other aspects of our performance. Thank you, Jack. So in relation to income, we've grown to be a considerably larger organisation than we were even just 2 years ago. That's really a reflection, firstly, of the impact of the Mental Health Investment Standard. And I think we had to be very grateful for that. As people can probably see, we've had more than a 15% increase in money flowing to mental health. And that's really been as a consequence of funds that have been protected for mental health coming out of NHSE. And we've been very strong beneficiaries of that. But not only that, also within our community services, you'll see that we've grown reasonably substantially. And of course, has been highlighted on previous occasions and earlier on this afternoon, there's a fair proportion of that comes from the delivery now of the IUCS service, the 111 service for Dorset, that has reflected itself in that extra income within community services. But not only that, it's also behind the deliberate commissioning policy that has put more money into community services more generally. And on the bottom line there, you'll see that we've grown reasonably significantly in terms of our staff as well over the course of the last couple of years. So we have grown by almost an additional 70 whole-time equivalents, which obviously will be represented in many respects by many more staff in headcount terms over the course of this last 2 years. So I think all of that is to be considered a success. Thank you, Jack. Where's the money gone? Well, an important thing I think from this graph shows that more money has gone into staff and the purchase of healthcare as a proportion of our overall expenditure. Naturally, organisations of our scale can't survive without a reasonably sizable portion of overhead, of which clearly a significant portion is building and premises costs, but we've been able to contain those, I think, reasonably effectively alongside what's called here other costs, which are clearly non-attributable to direct healthcare and so on. But naturally enough, we're a sizable organisation, and I'm pleased that such an increasing portion of our costs are going towards direct care. Thank you, Jack. Moving on to our capital expenditure, I mentioned that we didn't completely hit our plan. That was largely because we're part of something called LHCRE, LHCRE, which is the Local Health and Care Record Exemplar program, which is something we lead jointly. Well, we lead it, but we manage a program that runs across the whole of Wessex, so including Hampshire as well. And it's an exciting program, really, to create a patient record of data that is able to help frontline clinicians begin to understand patient need much more effectively than we've been able to do in the past, really by joining up records from local authorities, from the police, from the ambulance service, as well as acute providers, and of course the services we provide as well. And I think over the course of the next 5 years, we're going to see enormous benefits flowing from that as we create an infrastructure that covers the whole of Wessex. And indeed, we're having inquiries now about how we could deliver that service more widely than just Wessex, but across a wider patch into the southwest. We've spent a fair amount on our backlog maintenance. We've heard a little bit about the new Ribery ward down at Bridport. We spent close on £1 million on LED lighting as part of our sustainability strategy. And indeed, we've spent some money at Weymouth, expanding that service too. So these are all very beneficial projects. And indeed, we continue to have an ambitious capital investment program stretching forward as part of the strategy that Andy and Eugene have highlighted already, but stretching forward over the course of the next 5 years. So I hope that moving forward in subsequent years, we can show the benefits of that in a similar way. Thank you, Jack. How are we doing relative to everybody else? I think we can be pleased with our own performance in isolation. As I say, a very sound set of results, but I think even in comparison to other similar providers, where clearly the burden of providing care has got a downside, and on average, at least, other comparable organisations to us have been delivering deficits. We've grown faster. I think that's because commissioners are putting more trust in us as an organisation, and it fits. Dorset Healthcare is in the right position, if you like, to benefit from the strategy across the whole of the NHS, underlined by the NHS's long-term plan to put more resources into the community generally, and of course mental health in particular. We've grown our workforce more than on the whole other organisations have, and although we'd like to continue to control agency cost better, we are continuing to do pretty well relative to others, and indeed I think we'll show in the course of 2020-21 even an improvement on this. So as I started at the beginning, another sound year from a financial perspective. That doesn't necessarily come from the accounting team sort of keeping score, so to speak, but it comes from the wider organisation, our colleagues working actively to work within their budgets, work within their financial means, and at the same time to deliver higher levels of quality and outstanding safe care for the whole of our population of patients that we care for. So thank you, everybody that was involved in that. The whole of the organisation, I think, can be proud of these results, on which note I hand back to Andy.
Thank you very much, Matthew. As ever, my thanks to you and your team. You do a great job supporting our frontline services, keeping a grip on our financial envelope. So thank you. So that brings us to the end of the presentations. And now it's one of the most important parts is our ability to have conversations with you, our members, and to find out what you particularly want answers to. So I'm going to hand over now to Nicola Plum, who's our Director of People and Culture, who's going to bring together the questions that you've got. Now, she might not read everybody's question out because she's going to try and pull them together in groups of questions and issues, and then she'll invite one of our colleagues to answer that particular question. So Nicola, if I may, can I hand over to you, please, and the question and answer session.
Thanks, Andy. So yes, we have had a number of questions in. I think we've got 1, 2, 3, 4, 5, 6 questions that we will be working through, and I will be asking my exec colleagues to respond, so everybody gets the opportunity to hear from us all, hopefully. Not so much that I can group together. We've got a diverse set of questions that reflect the diversity of the things that we do. So first of all, I'm going to ask Dawn Dawson, our Director of Nursing Therapies and Quality, to answer the question about the plans we've got to support mental health carers across Dorset in the next 6 months. So Dawn, thank you.
Hello, so thank you for the opportunity to answer this question. And I think it's really, really important that we recognise the vital role that carers play to many people. I'm a carer myself for somebody that has mental health issues, so this is a subject that's close to my heart. And I think that when you have a chance to see our quality strategy, you'll see that within that strategy, one of our key pillars there is about our desire to continue to strengthen the work that we've already done, specifically around the triangle of care. I'm sure many of you are familiar with the triangle of care, but this is the way in which we come together as the individual that's receiving the care that they need, a carer, and the healthcare professional to make sure that that care is as full and as complete as it can be for the individual. So in terms of our mental health, we've already achieved our 3-star accreditation for our mental health services, but I think it's really important that we broaden that out now to our community services and also to our more physical health services as well. So that's a key plank of our strategy. And I think it would be remiss of me not to sort of note the impact that the pandemic's had on carers across the whole of the country. So we know that some carers have been concerned that actually they may be struggling or feeling isolated, or are worried about perhaps becoming unwell themselves and not being able to provide the care for the individual that they support. And so as a result of that, we've undertaken a number of developments that have been led by Phil Morgan and by Pat Wilkinson. And so what we've done is we've provided a signposting resource for staff so that staff know where to direct people to get the information that they need and the help that they need. We've also got carer awareness training webinar that's been recorded and uploaded, and that's been co-produced with carers. And then the other thing that we've done is we've worked with our carers leads to make sure that we've got increased telephone support, to make sure that we are enabling and supporting people to access counselling service that are provided by the voluntary sector, supporting people to join virtual support groups, as well as making sure that we keep an absolute key focus on offering carers assessments, so that they did dip at the beginning of lockdown, but those numbers are now coming up again so that we are supporting those individual people. And then finally, the other thing that we've done is we've developed some podcasts around wellbeing with our recovery education centres. So that's all there available for our carers. So I hope that answers the question for you. Thank you very much for this opportunity.
Thank you very much, Dawn. And of course, with this format, audience, you are welcome to leave your questions, and we will be able to answer them. I think if you're not satisfied with an answer, we've got more questions you'd like to ask, then we will publish an email address where you can send in for further information, and we can continue that conversation. I appreciate we can't do the sort of backwards and forwards that we might otherwise have done. The next question that I'd like to ask Eugene to respond to relates to the recent announcements from the government about additional funding coming into Dorset. And the question is asking how much has come from the government towards the new hospitals that were recently announced, what the plans are. And there was also a further follow-on question where somebody has asked, will there be more jobs associated with those new hospitals? So Eugene.
Thank you, Nicola. So we are always welcoming of investment into our local services, and the government announcement around the new hospital build programme, the money that we're getting for those hospitals is still to be determined. We have received 17 million to work through the business cases, and like with all things funded through the Treasury, I think there are a number of gateways that we need to go through. What is not in dispute is the fact that from the money that has been allocated for Dorset, we will be getting a new children, adolescent, young people unit, which is a CAMHS PQ, and we will also be looking at how we bring, as a continuation of the clinical services review, some of the community hubs that we've talked about, primarily within the acute hospitals. So this is something that we've still got to work through as we develop those plans, but we already have the funding to be able to start creating what are the outline and business cases that allow us to be able to progress through the Treasury process to get the money. The second question was, will they be new jobs? Yes, is the easy answer to that. I mean, for some of our building projects, there will be a repurposing of what we have already. For others, like the CAMHS PQ and indeed the community hub within the acute hospitals, those will be additional facilities, additional beds, which will require us to be able to recruit and attract to our workforce across Dorset. So there will be opportunities not only for new jobs within those services, but also opportunities created through the development in the construction sector for those particular hospitals.
Thank you. The next question we've had that's come in is about people's experiences with 111. We've heard here that many people do not have a good experience when they're engaging with 111, and they feel like they're being treated as a tick list and not as individuals, which of course is difficult to hear or disappointing to hear. We're being asked here, how do we plan to get the public on board with our new plan? And I've asked Chris Domney, who's our Deputy Chief Executive and Chief Operating Officer, to talk a little bit about our plans for 111.
Thanks very much. 111, we know, has had some challenges over the last few months since it came into the trust. And one of the things that we're doing is to work with our clinical commissioning group colleagues to increase the number of people that we have available to take the calls. As a result, we're expecting our service to improve as a result of having more call handlers and more clinicians to take the more specialist advice. We are in the process of a recruitment campaign to increase the number of call handlers that we have, and to make sure that we provide them with the right training at the right time to manage the calls with the variety of different questions that people come into the service with. We know that the NHS is requiring us to implement a 111 first model, which is really about the first point of call for any access into any treatment system or setting through the 111 system. And there will be a comms plan and a comms engagement to communicate with the general public, to talk to them exactly about how to do this. And we are part of the development of this service. And we are hoping, alongside every other 111 service across the country, of which there are 38, to start with the 111 first model on at the beginning of December. So I'm confident, through the plans that we've got now and the recruitment that we are undertaking, that the service that we are able to provide to the general public and people calling into 111 will significantly improve. And we continue to be absolutely committed to providing the best possible service we can. But we have had a number of vacancies across that service, so we recognise that things haven't been as good as they need to be. Thank you.
Chris, thank you. Eugene, I'd like you to come back online, please, to respond to the question from Pete Kelsall, who's asked about the proposed new CAMHS hospital and whether or not it's going to include intensive care facilities. So CAMHS is child and adolescent mental health services. So there's a proposed new build for our children and young people who are struggling with their mental health. Will that include intensive care facilities? And will that help us then end out of area placements for young people? So this is when young people, when we don't have the available beds in county and they have to travel elsewhere in the country.
Thank you, Nicola. And in response to Pete's question, yes, we will, when we develop the new CAM service, have intensive care beds. So we are looking at developing an 8-bedded intensive care unit, which will stop young people having to travel considerable distances from Dorset. And I think the nearest intensive care unit that we have to be accessed for young people and their families from Dorset is about 100 miles away, which is a considerable distance. So we are in the final stages of designing what this new building will look like, and we'll start engaging with partners in the local authority so that we are successful when we go for planning. Already the discussions that we've had with the local authority colleagues have been a lot more encouraging than we had last time. So we are confident that we are on the right path to be able to deliver the right service that will stop young people going out of area. In addition to this, we also have some building work currently underway at Pebble Lodge, which is our general adolescent unit, where we want an additional 2 beds for high dependency. And I think this is a good stopgap for us to have a higher acuity setting for young people who would ordinarily spill into CAMHS PICU. It's only 2 beds, but it gives us some capacity to be able to better manage young people when they need higher levels of intervention because of their acuity, and to keep them in Dorset. So both encouraging developments, but certainly we are working hard to be able to go through planning early next year for us to be able to look at developing the CAMHS PICU over the next 2.5 years. Thank you.
We've just put a call out to ask for any final questions, because I am just watching the time. There's 2 questions about things that have been published. So the first was about when we're going to publish the results of the governor elections. We have already published the names of those elected, and the full results will also be published by close of play today, so you can expect to see that on our public website. And we've also been asked about when the final version of the quality strategy will be published. This has been produced across the year with some considerable engagement. The Trust Board did sign off the strategy, the quality strategy, as part of its review of its overarching strategic framework. That is available in the board papers. We are now in the process of preparing some materials to share this much more widely. However, for anyone who would like to have a copy now, of course, please drop a line to the email address that we've published in the live event Q&A, and we will be able to send you a copy as quickly as possible. So those are 2 questions about items being published. Matthew, we've been asked about our IT infrastructure and whether or not it links through to our benefit IT systems. I don't know whether or not you'd be able to answer that question.
Thanks, Nicola. I can broadly answer that question, partly because I think that probably stems from my comments about the LACRA investment that we're making. So I guess the first point, which is the data record, if you like, data sharing of information between health, police, local authorities, and so on across Wessex. I guess the first point to make is that we only share any personal information that is for the benefit of direct care, and that's a very specific provision within the GDPR regulations, which are the General Data Protection Regulations, and of course, naturally, as an NHS organisation, and the duty of care that clinicians have towards their patients is something that we respect in the utmost. So when we're talking about the local healthcare record exemplar, and it has a number of other names to it, it's really all very pseudonymized data, which means that it's not attributable to anybody by name. It is literally raw data that helps us really to shape services and pathways across the wider system, and we can draw meaningful information from that helps us, not attributable to any one individual, but that helps us design services in terms of the meeting of demand and capacity across the system, which obviously has links with the demand for services amongst our public sector colleagues more generally. So I hope that answers the question that perhaps was specific to comments made earlier.
We've got 3 more questions now. I'm afraid they're still quite specific. First of all, I'm going to ask Dawn if you would respond, please, to the question about training that's being done in relation to multidisciplinary team working.
Hi, yes, so I suspect there's probably a very specific question behind this. And if I don't pick up what the person that's asking the question wants to know, please just feel free to contact me independently after this. I suppose it's really important as we look to our future models of care, and we're beginning to talk about truly having person-centered care and wrapping our teams around that person to make sure that we have the most effective and efficient use of multidisciplinary team working that we possibly can have. And I think it's broad in the sense that the question alludes, so it's talking about the police there, but I think also we need to think about housing, we need to think about the voluntary and third sector, and about how those other teams work with us to really shape the services that we provide for an individual. I think it's something that we do as part of our everyday learning. It's about innovation, it's about learning from when we don't get things right, so either when we've had an incident, or from, again, learning when things go incredibly well. What did we do that made that work really well for that individual person? So we don't have generic training around this, but again, I'm really happy to have a conversation with the individual who asked the question. I think it's much more bespoke about the team that you work in, the type of care that you're delivering. Thank you.
Thank you, Dawn. We have now closed to questions, so I'm sorry there are a couple that have come in, and we will be asking you to email us separately. We will also publish all the questions and answers on our website so that everybody's clear about the things that have been asked. Very lastly then, two last questions. Chris, if you could talk to us please about digital apps and digital access to 111, please. So I've been asked, how do we expect to allow access to 111 via digital, such as apps or a digital assistant?
It's difficult to answer that because we're in the stage where we've just transferred the telephony that 111 transferred over to Dorset Healthcare from South West London Ambulance into the Trust's system. So we are now on a new telephone system with 111. I suspect that over time, with all the digital innovation that has happened as a result of some of the work through COVID, that we will begin to develop our digital platform for 111 over the next few months. At the moment, we don't have any firm and committed plans to do that, but I am sure that with the innovation that's happened, we will be able to do more of that over time. So right now, I can't say when that will be.
Thank you very much. And just before going to Eugene to answer the last question, just want to raise for people that we've got a couple of comments thanking our lead governor and the Council of Governors for all of their hard work and commitment. Thank you. And also Tim Goodson, who is our CCG Chief Exec and leader of the Dorset system, has also said a big thank you to everyone at Dorset Healthcare if you are not following the live event Q&A. So thanks for those comments. Eugene, I will come back to you with the last question. And Stephen, who's also one of our staff governors, has written here about people growing more frustrated at the changes made to services as a result of COVID. They're starting to voice their concerns to staff. That can become very challenging and perhaps aggressive. And that's understandable about the significant impact on the well-being of some staff. So really just coming to you to wrap up for us, how do you think we can best support our colleagues so that patients and service users are not taking out their frustrations on our hardworking and caring professionals and colleagues who are doing their very best?
Thank you, Nicola. I think this is something that I have witnessed myself on a number of service visits. And I guess if you imagine living with a long-term condition or pain, you can get to the point of absolute frustration. So we will do our very best in terms of ensuring that we are clear with members of the public and our communities what services we're stepping up, what services still remain in abeyance, because that helps when they are contacting services to know exactly what to expect in the first instance. I also think that despite all of that, there is more that we can do in terms of sharing information within the organization, but also supporting teams and having bespoke support offers, particularly where we know that they are services that have a high demand for what they do, and people aren't able to get through the service quickly enough. So we've seen this already with the audiology service, where people might have been waiting for what they consider an inordinate amount of time, and sometimes that frustration is spilling out when they're contacting the service, and staff are on the receiving end of some unacceptable abuse. So what we've done there is to ensure that there is a dedicated message for people calling into the service, but also we have some dedicated psychology and support for staff, because a telephone message asking people to bear with us may not be adequate to stop some of these things from happening. I also think that we will continue to provide the Schwartz rounds, which we've been making available over the last few months, because it is yet another opportunity for staff to be able to share their experiences. As a leadership, I want to recommit to ensuring that we're sharing as much information as we can early on, so that we are managing expectations within the services across the trust in terms of what we're going to be doing and when we're going to be doing it. But none of these things are perfect. So I think there is an element of just going again, as it were, in terms of the communication and supporting our staff and ensuring that as often as we can, we're learning from the things that we're not doing as well and implementing them to make the services better. Thank you.
Okay, so thank you very much. That wraps up then our Q&A session, and it leaves me now only to pass back to our chair, Andy, to close the meeting.
Thank you, Nicola, for handling those questions and giving them to your colleagues so professionally. Could I say now to everybody that has joined the meeting, thank you very much for your questions. It has been really helpful. Like Nicola said, if there's questions that come through that you want to follow through on, then please take up on Dawn's offer, etc., to further develop that line of conversation. Thank you for joining the meeting and learning about our amazing staff are still trying to make Dorset Healthcare outstanding with all our services. We really do want to be better every day so that every patient in Dorset gets the very best service that we can possibly deliver to them. In my final reflection really is that it's incredibly sad how we've had so many COVID casualties over the last few months, but we must, as individuals and as groups, work together to make sure that Dorset remains a relatively low incidence area of COVID infection. And I know my colleagues and I will do everything we can to support that health and safety environment. There is, of course, an opportunity with every difficult situation, and there's an opportunity here to push creativity and innovation so that we can deliver our services in a fundamentally different way for our patient groups, and through doing that we will be better every day. So thank you to our guests, thank you to the presenters, thank you to the backstage team who have done a great job managing the anxiety of the chairman in the first time he's done an annual members meeting. My sincere thanks. And to our wonderful staff, thank you again. Stay safe and have a good evening.